Yes, yes. This is the Lisa Baxter Show, giving you the 411 and the kidney one. About my girl and say, this is. You sold me so many times. You sold me so many times, and I don't want to be sold anymore. I want to be with my family, but you sold my children. You sold my children. You beat me. You come into my room. I don't like it. I don't like it. Mm-hmm. Who is Harriet Tubman? I need the Underground Railroad. I don't want to be a slave anymore. I don't want to be a slave no more. Ooh, but I just know one day God is going to get us out of this. This is not going to be like this anymore. And we'll be able to do things and be smart and go to school and get jobs and own our own business and be entrepreneurs. We won't always have to go through this. And because I know through generation after generation, a beautiful person was born, and God bless her to do this work, because this is the Lisa Baxter Show, giving you the 411 in a kidney world. Hey, everybody, good afternoon. I had to do a little skit tribute for Black History. And we'll do something maybe for all you lovers out there. How about that for Valentine's Day? Oh man, I'm glad you tuned in, because we have a wonderful show tonight. A beautiful couple, a dynamic duo, somebody that's going to bring the house down and bring the education, the transplant stuff, the whole thing, the kit and caboodle. Let me tell you who I got. I got to introduce them. How about that? I have Mr. Ira Copperman. That's right. He is the co-president of Transplant Support. And his wife, Glenda Daggard, is a double a transplant recipient. She has a kidney transplant and a pancreas transplant. Now we are going to definitely hear her story. She's a board member with the Transplant Support. So I want to introduce them and welcome them to the show. Come on in, the dynamic dual couple that's been married for such a beautiful long time. We got to hear those secrets.
So that's a great introduction. Thank you.
Thank you.
Oh, you welcome. Well deserved. Well deserved. I appreciate how I met you guys when I got a transplant myself, and I dialed the number because it was on the list of things that Mount Sinai gave me. When I dialed you guys up, you guys listened to me, y'all heard me, y'all gave me information, and y'all were just a beautiful help. So I have to say thank you about that.
Well,
our pleasure.
It's our pleasure to be able to share whatever we have, and if we don't know it, we'll find it out.
I know that's right. Well, since then, we've been in a lot of circles, with Live on New York and everything. Yes. And the St. Patrick's Day, the transplant a thing that they were giving, they give every year that I love going to. I went my first year when I got my transplant. So I'm glad to be in you guys' circles.
Thank you.
St. Patrick's, remember and rejoice.
Yes. Yes.
Amazing couple of hours for all of us to spend together.
Oh yes, oh yes. You know, tributes to the one that gave the kidneys and beautiful and love and respect. You know, for their families and for them and for all the brave ones that stood up and did this kind of thing. You know what I mean? And even the loved ones we had lost. So I did enjoy that, and it was just a beautiful thing. We had talked about that before on the show for more people like to get involved with it. But
Yes. Sure.
well, I'm going to get right into it. I'm going to start with you, Ira, first. I'm going to go back and forth. All right? Don't worry. We're going to play with this thing till we get it right. How about that? Okay. Now, before you started transplant support or was a part of transplant support, what did you do before?
Glenda and I met and married in 1976, and
Ooh.
I knew that Glenda had diabetes and what that might happen, what the outcome was. It didn't matter. This
Mhm.
was this was just somebody that you can't ever forget. And we were both working at the time, right after Glenda moved to New York in 1976. Very shortly thereafter, Glenda started working at IBM. I was already working at IBM. So we
Mm.
had a lot we were able to do together and to be together. We were actually in the same office for a little bit of time together, and
Wow.
we had wonderful careers. Mine lasted until about 1999, and then I left IBM and went out and did a couple other things. Um,
Wow.
and about that time, 1997, I'm sorry, is when I left IBM. And come around 1998, 1999, we knew where Glenda and I had to go to manage her health problems that were getting increasingly of concern. So
Mm.
we had we had 20 wonderful years to prepare for it, and we think we were completely and totally prepared.
Wow. I love that idea that you got yourself prepared for that. Not many couples have that chance. You know what I mean? My husband and I, we tried and we did the best that we could, and we worked together with the illness. When I was sick first and he was sick second. But what
Right.
I love about you guys, you said you had 20 years. At least you was willing to prepare. You don't have that many people, whether they're a couple or not, willing to prepare for illness or what's going on. So at least you knew what was going on. So you found out that she had it, and you
Yes.
guys started working together.
Yes.
Let me see. Now, I don't know whether to go back and forth here. Glenda, what was that like when you found out that you had diabetes and these things, these health problems start to come about? Talk
Well,
about that, sweetie.
I was actually 15 years old when I found out I got diabetes. There's no
Wow.
his- there's no history in my family. It was type 1 diabetes.
Mm-hmm.
And of course, all the classic symptoms hit me within a couple of weeks. You know, constant sleep. I lost 20 pounds. I was urinating all the time, drinking water all the time. And the doctor took one look at me and knew what was going on. Even though there's no history in my family, I do hear this story. Every time we go to a school, there's at least one student who the same thing happened to. So I had diabetes for 40 years, and I had it already when I met Ira. I
Wow.
had it for 15 years already when I met Ira. At that time, I had, when I first got diabetes in the early 60s, we were taking one shot of insulin a day. It
Mm-hmm.
was insulin from beef and pork. It was not pure. It was not made in the lab like it is today.
Mm.
We didn't have pumps. We didn't have disposable syringes and needles. I had a glass syringe and a metal needle that felt like it was about that long, that I boiled in water every morning to sterilize and reused that needle for a couple of months at a time. You can imagine
Wow.
how dull it would get after using it over and over and over.
Oh yeah, it's harder to stick when it gets dull. Don't go there. Mm.
Very hard, very hard.
Well,
But
stop 1 second. stop 1 second. When you was a teenager and you knew you had diabetes, did you have any trouble being out with your friends or following the diet because you were young?
I guess I'm a rule follower. I was told the rules and I stuck to the rules. So
I ain't mad at you.
so I didn't have ice cream, I didn't have chocolate, I didn't have sodas. I just didn't. I'd go out with my friends and it wasn't really a problem. I didn't feel deprived. In fact, I didn't discover diet soda, a tab, until 1964.
I remember that.
Yeah, when we came to New York on a high school trip.
Wow.
So, you do what you have to do, as you know.
Oh yeah.
I think one of the things that Glenda shows over and over and over again is that by doing this management, by being self-controlled and by being disciplined and all that, her life was graduated from college and became a phys ed teacher. I mean,
Wow.
You can't think of anything that's going to test your body more than that. And yet it was a very successful part of life because Glenda had the discipline and the control and the will, which is what has carried us forward since the day of her transplant, to make a successful life, to have a successful life. So you cannot sit back and say, oh, woe is me. That's not acceptable. At least it was not acceptable to the two of us.
Right. Or why
Wow.
Why me?
I don't think
No whining? No wham about it, huh?
Yeah. We don't.
Well,
Why me doesn't exist in our vocabularies.
Well, it's not. I remember my husband saying it wasn't going to help. He said that he had to come to that conclusion when he, had colon cancer, and they told him that. And
Right.
he, we cried about it already. We prayed about it. So, I guess sometime when you have to think of what you're going to do next. Once you find out, you got to deal with this thing head on. So, I do get and understand that. You was a physical ed teacher. I know. What is it? Exercise really helps when you have diabetes, certain illnesses and stuff like that. So that must have helped you, or you must have discovered or knew that.
Well, that's why I chose that field, because it was important to stay active. And
Wow.
I didn't want to be sitting behind a desk all day. So.
Well, okay. Well, you've got 2 double transplants, right? Tell me something about that.
I got a simultaneous kidney pancreas transplant from an unknown deceased donor, whom all I know about is from my surgeon, who told us that he or she was a young person who died from a stroke.
Do you want to?
Wow.
When a year before that, when we started doing the research.
You say, I don't know what you're
okay.
mean.
Well, we knew that the doctor, Glenda's kidney doctor, said that he's going to do everything he possibly can to forestall the bad next steps. And that, again, Glenda stepped up to the plate and showed how she could manage diet and exercise and work, never missed a day of work.
Wow.
But in the late 90s, it just became apparent that with all of Glenda's self-control, with all of Glenda's management of her diet and what she ate and how many times we tested for diabetes during the day and in the middle of the night, as a matter of fact, that her kidneys were just not going to make it. There comes a stage where kidneys just kind of continue to escalate, and you lose more and more function regardless of what you do. So in 1998, when that became the point where we really were confronted with the decision of what's next, once again, we sought out the right kind of medical care to tell us, yeah, you know what? This transplant stuff for a kidney does work. And by the way, transplant stuff for a pancreas also works. So
wow.
in 1998, in April of 1998, Glenda got enlisted in two places, here in New York and
Okay.
also in Minnesota, because her
Wow.
doctor thought that Minnesota might be a little easier in terms of finding a match because of ethnic background.
Because I
and
grew up in the
you
Midwest.
kind of grew up in the Midwest.
Oh,
So
well, how sweet. What a connection.
yeah.
Yes,
And
what a connection.
yeah, so we were enlisted in both places, and in starting in April of 1998, we got a pager from no cell phones. Cell phones didn't exist. We got a pager from both hospitals, both transplant centers. Glenda would
Mm.
wear one, I would wear another, and we waited. We started the waiting game, and yet Glenda's commitment to doing the right thing every day, 3 times a day, 4 times a day, 6 times a day, 8 times a day, just continued. I mean, this was not going to be, this was just another step on the journey.
So
And
when the beeper said beep, 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 you knew what was going to happen. Tell me what happened then.
The first time we heard it, we happened to be in Chicago for the weekend, and we thought it was the ice cream truck.
Wow.
Twice it had gone off, and I think both times it was a drug deal that called us by mistake.
Yeah.
It wasn't the hospital.
Oh my goodness.
We didn't really know what it would sound like. But that was the first call of 3.
Mm-hmm.
Actually, in 5 days,
yeah.
in 5 days, I got 3 calls.
Right.
And the
Wow.
third call was the charm.
Wow.
Yeah.
Well, what hospital did you get your surgery in, if you don't mind saying?
Weill Cornell.
Oh, I love that hospital. Oh, yes.
Yeah.
Mm-hmm. Mm-hmm. Wow.
Yeah,
So both of them was in Weill Cornell.
Uh-huh.
How was your recovery dealing with that?
We did some preparation for the surgery because I was afraid of it would be a very painful thing.
Mm-hmm.
And Ira found a set of surgical preparation and healing tapes from, actually it was from Columbia Presbyterian.
Yeah, Columbia Presbyterian.
From Columbia Presbyterian. The source was in Maryland, though, I believe.
I believe that's right.
So for a year, or for 14 months,
Yeah.
for the whole time that I was registered, every day I would listen to this surgical preparation tape. It was about 50 minutes, and it was that new age, relaxing music and words saying to me, this is going to help you, you're going to get better, that kind of encouragement.
Yes. Mm-hmm.
I made sure I walked a mile every day to stay in good physical health. And
I'm not mad.
Yeah. So I think I was mentally and physically prepared for the surgery. And when it came, I wasn't afraid. Ira was with me every step of the way, even when we went to the hospital. 2:30 in the morning, we're sitting on my bed, and the surgeon walked in his scrubs, and he said, "How are you guys doing?" And Ira said, "Wait a minute, how are you doing? You just got out of surgery." And he said, "Oh, a couple hours rest and I'll be fine." So at 10:30 that morning, I went in, and 4 hours later, I had 2 new organs from my unknown hero donor.
I think an important thing to say is when you go to the hospital for your the very first time you ever meet the doctors and the staff and all that, the doctor said to Glenda, "Well, look, this is going to be a real surgical challenge. It's 2 organs, got to do it right. And so your surgery will probably be anywhere from 6 to 8 hours. And you'll probably be in the recovery area and in ICU recovery for about a week. And we'll get you home about 2 weeks after that." But it's just another reflection of what Glenda did. Her surgery, rather than 6 to 8 hours, was 4 hours. Her ICU recovery was 3 days. and that was only because they had to make sure one of the organs the blood connection wasn't leaking. They wanted to make sure, and Glenda was home in 10 days.
Wow.
That could work in a month.
Back to work in 3 weeks.
3 weeks, that's correct.
The
Right.
third week was just gravy.
So
that is fantastic.
This kind of thing about really a positive attitude, and it is going to work, and this is what you've been working toward and dreaming of, and not that you're done. There's going to be things you got to do whenever, even the day after transplant, you're going to be thinking about those pills and going to your aftercare and going to see your doctor and taking all the blood tests and all that. But every step of the way is part of this really unbelievably rewarding and happy journey that in some ways you get to go on. I don't know. It's
Wow.
It's been, and it's led to so much of the way Glenda and I have been able to think about our lives since then. Little things still bother us, of course, but not like they used to.
Wow.
There ain't no big deal things anymore.
Well, the thing is, I knew where I was headed with diabetes, and it wasn't going to be a very long life from where I was at that point. So I know people said I was trading one thing for another, one illness for another, but
wow.
But I didn't feel like that to me. To me, it felt like a cure for diabetes, and never in my wildest dreams did I think I could live any of my life ever again without that hideous disease. And here I am, 20 years later.
Well, you never experienced dialysis, huh?
I'm sorry, what?
You never experienced dialysis, right?
I missed it by about 2 months.
Okay.
I had my fistula. I was all ready to go when the calls started to come in. And 2 years after my transplant, I had my fistula reversed. The surgeon told me if I need it again, he can put it right back in the same spot.
Wow. Mine is still in there. I'm trying to get them to flatten it or do something with it. Yeah. There were so many things that went on that I haven't done it yet, but I'm still aiming to do it. But I'm not ashamed of my arm. I wear anything I want. Absolutely. What was the high and lows of your transplant?
I'm sorry.
Ms. Glenda. The highs and lows of your transplant.
Oh, highs and lows. Probably the lows happened in the beginning when I would get dehydrated and start to feel really tired and droopy. But as soon as I go into the Rogerson clinic and they took one look at me, they put me on a drip, and a half hour later, I was back to my perky self. So
wow.
I don't really think there are too many lows. Sometimes dealing with the medication and the insurance companies is a real bother. Not just a bother.
You ain't never lied.
It's so aggravating the way we're treated. That's probably my lowest thing to have to deal with, the way we have to deal with it.
Well, it gives us a perspective that if we have to deal with this the way we have to, it gives us a perspective of being available to help other people or find help for other people when they ask us for help about this kind of thing. It's horrible the way the system just doesn't only thinks about people managing sick people instead of helping people get well. If they would think about it from the perspective, what can we do and you're going to do the same things, but it's going to be a totally different perspective on how you answer questions and programs you set up and all that. And quite frankly, it's been an important part of the extracurricular activities that we've tried to stay involved with, because we've been able to take our experience that we have in dealing with this issue and try to make the powers that be, the Congress, Medicare, Health and Human Services, CMS, and all that, and make them think about how they ought to be getting their money's worth. They pay for a transplant, now get people back to work. They want to go back to work.
Yes, I did. I went straight back. Yes.
They want to do what you do, be productive, get out in society, go make the visits to the clinics and all that. People are upset when they're spending sometimes 5 to 10 hours a month dealing with drug prescriptions, insurance companies, paying for visits. It makes no sense whatsoever. So I like being able to tell some of the stories we get to tell to congressmen, to senators and Republicans.
Me too. Me too.
Yeah, let them see how they're getting gypped.
We've been to Washington a few times. We're going up to the state again. We've lobbied for budget for organ donation. We'll be lobbying again in April. Just have to tell you real quick, because this is one of the stories we can't get over with the drugs. Once I had one of my transplant drugs denied by the insurance company because we finally found out I wasn't taking enough.
Oh, wow.
My dosage was less than the standard dosage, so they weren't going to pay for it. How stupid is that?
Not that the doctor had done the right thing to say, well, this is all you need. No, they were going to deny it because Glenda was not taking enough of the drug.
Just stupid stuff.
Very stupid.
It's a great story. You should see what the reaction we get from senators and congressmen and their aides. They shake their head.
I believe you. I went down there with Sydney, Center for Independent People with Disabilities, and we were doing that thing too, because, disabilities as well as kidneys and stuff like that. You just got to fight for it all. And, you're all up in their face with it, because, we care about this, and you can see we all passionate about this with this network, this show, you guys. Let me ask you, how did you start your organization or transplant support?
You want me to do that? Well, we're very lucky. The organization actually was the brainchild of 3 people back in 1997. A woman received a liver transplant at Westchester Medical Center, her doctor and her social worker. And this woman, Helen Bellhouse is her name, said, she was talking to her social worker. She said, it sure would be nice if I could find out, a little bit more about what people have gone through. And her social worker, this wonderful woman named Karen Farkas, who's now retired down in Florida with her husband, they went to Helen's surgeon, Dr. Khalid Butt, and he said, that's a great idea. Why don't we meet in my office and we'll figure out how to start an organization. So excellent. This organization was already in existence in about 10 years when we heard about how they were able to go into the local schools and tell this story, New York schools, and tell the story about transplant. Kids in junior high school, they're not afraid of this. They want to.
No, they're not. They're not. Some of them want to be done.
The truth. And they'll ask.
They get it.
They get it, and they'll ask any question. Don't give them a line of baloney. So we came into it by volunteering to go in and speak at schools. And as we saw how wonderful and how committed the organization was, we just wanted to be more and more a part of it. And then little by little, we did a little bit more of it. We got on, we were asked to join the board. We got on the board. And then for the last number of years, we've been sharing offices and responsibilities, vice president, co-president, and
Mm-hmm.
it's this wonderful group of people.
Very
who
active group.
active, committed, dedicated, and in general, happy.
That's
Happy
good.
about seeing the light of day every new day. And that's that's the difference. You ask what's the difference that brings these people together? It's that they're happy people.
Wow, wow. Well, what is the website for that organization, please?
Oh, Lisa, you're wonderful. Thank you. It's
Mhm.
www.transplantsupport.org.
Excellent,
And
excellent.
thank you for that. We really appreciate your allowing us to give a plug.
Oh yeah, oh yeah. I've already put you guys on the page and everything. Took pictures of your newsletter because some people don't
Thanks.
notice you guys have a newsletter. And how
Yeah.
could they get involved or what they could do?
That's right. And there's always plenty to do.
Oh, I'm sure.
We have no shortage of events or activities or requests for somebody to speak or to be a speaker, give their own personal experience. We can fill meetings 12 months a year if we did.
But we're not exclusive. We
Okay.
feel very strongly that regardless of where someone had their transplant, where they live is probably where they would like to be part of a support group. So
excellent.
we try to stay in touch with the groups in various areas. Ira and I live in Manhattan, so we also belong to Trio Manhattan.
Yeah, in the trio, yes.
There's a group on Long Island, a support group on Long Island. There's one on Staten Island. There's one in
Right.
Rockland County.
Wow. Well, what is the website again? I was going to ask you that because I'm getting a little clue about that. Repeat the website for me. I'm so sorry.
No, I'm happy to do it again.
So they can put it up.
Okay.
Steve.
www.transplantsupport.org.
If somebody wanted to do this type of thing, you know, maybe they wanted to do their own support group, what would or organization or something, what advice could you give them or what steps could you give them, would you say?
I would say don't go off and start something on your own. When we have all these groups already in place,
I ain't mad at you.
Let's work together. We don't need 15 different groups starting their own thing. Let's work together. That would be my biggest advice.
Okay.
In the 5 or 6 groups that are in our local New York area, there is plenty to do. I mean, no end of activities, as I said, for people to be involved. Letter writing, going to Albany, going to Washington, going to volunteer in New York, volunteering with us, volunteering on Long Island, volunteering in Rockland County. That we can, if you want to just get in touch with us, if you live in Orange County, I'm going to tell you about our friend Ellen Dunn in Orange County. That's the person you want to talk to. If you live in Long Island, call us. We'll tell you about Long Island Trio. We don't need people schlepping up to Westchester just because we want to see our numbers.
Wow.
You go.
That's
locally, traveling is not the big part of getting stuff done in this world.
The other thing can I say one more thing, Lisa? We really
go ahead.
Keep asking all of our recipient friends, please write a thank you to your donor family. You write it anonymously.
I did.
The hospital. And it's just such an important thing to do. Is you don't have to be fancy. You just say thank you for saving my life. That's all you have to
say. It's therapeutic. The reason why I asked you about how you started, because Lisa Baxter or this network doesn't cover New York. It covers a lot of other places that's not here. So if they wanted to start it, I guess maybe they can just go to their local hospital or something like that.
Or call me. I will be happy to work with you to find out the name of the group in Florida, in Georgia, in Ohio, in
I love
Minnesota.
you.
Please call me. The idea is find an army of people across this country who are committed and who want to work in some form in these organizations. I'll help you find the group.
That's beautiful. That is just so beautiful. I can't help myself there. That's beautiful. Now listen here. Listen
Yes.
here. Is there anything that we've forgotten before I end the show? Because I'm going to ask you to give a shout out to someone, or any people or place you want to give the shout out to, for, and about. But is there anything we didn't cover or didn't say, or something you want to say that we just totally missed? I missed.
Another thing we like to do, Lisa, that I think is so important is to go to the hospitals, to make rounds with Live on New York, to say thank you to the doctors and nurses who have so much work to do to help our lives and to help our donors help us. So whenever we get the opportunity, we like to be able to do that. We've been to Mount Sinai at midnight when the shift changed.
Well, that's where I got my transplant.
We went to Long Island at 7 a.m. in the morning, because that's
wow.
the shift change, and the operating room staff was having a little lunch in their break room. We had one woman come up to us, a nurse, afterward, who said to us, I have been here for 30 years and I have never met a recipient. That is wrong.
It's sad.
We want to give a shout out to the professionals. Listen, everybody understands that there are donors and donor families who qualify without doubt as heroes. If you think firemen saved lives, if you think policemen saved lives, your donor saved your life. That donor
That's right.
But in the chain of events, the doctors, the nurses, the operating room staff, the guy who makes sure the instruments are clean, the critical care units, all of those are a part of what need you to be able to have a successful life.
Oh yes.
So that's our shout.
Yes.
That's our shout out.
Wow, that's an excellent shout out. My hat off to the professionals. I love that. You covered the gamut. You covered the gamut. And I definitely appreciate you guys coming on the show. I love being in your circle, like I said, and out there, and we're just all trying, and we all doing. So I'm very proud of you. I appreciate you. Keep doing that wonderful work. And just thanks a whole lot. I thank you. Thank you.
We're honored you had us on your program.
Could I say one more thank you? I think we need to thank Live on New York too, our regional organ procurement organization.
Sure.
Helen Irving is so supportive of all the support organizations. She has recently authored, without their name on it, a brochure that lists all of the support organizations in her coverage area. And we have been meeting with the social workers at the hospitals to ask them to put these brochures in the folders that their recipients go home with, and in the folders of the people who are coming in to get signed up to be on the waiting list. Because it's so important to have people like you and people like us and our groups to talk to. So you don't go into something blind. You go in knowing what's going to happen and knowing that you can come out of this a healthy person.
Wow. Oh yes, you ain't never lied. We need all hands on deck. We need that's how I found you. You were in my packet at Mount Sinai. You know what I mean? So, somebody's doing something somewhere. You know what I'm saying? So, and I do volunteer with Live on New York and everything, sign people up and everything like that. So I am not mad at you. I appreciate you. You have a fabulous night, and just continue to tell the stories and put yourself out there. I want my newsletter. All right.
Okay, you're on the list.
You're on
It's
the
coming
list.
up end of February.
That's right.
That's
But
right.
have a good night and
And
thank you
thank
so
you,
much.
Lisa.
Stay
Thank you so
Thank
much,
you
beautiful,
very
Lisa.
stay
much.
blessed, and stay positive.
We will.
You too.
Thank you. Woo! Was that a ride or was that a ride? A ride of, oh man, so much information, so much learning, so much everything right there. Beautiful couple that's doing this thing together. And with this organization, they're still doing stuff together. A lot of years of marriage, a lot of years of work, and a lot of years of dedication. So I thank you for tuning in. Thank you for being a blessing. Thank you, because sharing is caring. Take care of your kidneys, and they will take care of you. Good night. God bless. Peace. Y'all ready for this? Yeah. This is the Lisa Baxter Show, giving you the 411 and the kidney one. My girl, and say, this is